Pain management is often a concern for cancer patients and their families. And here in the U.S., we typically have our choice of treatment or medications to help control the pain. Unfortunately, that is not the case everywhere. The Pain and Policy Studies Group is a local organization making a huge difference around the world. And this week, the world has come home to Madison. Joining us today in the studio are Karen Ryan, who leads PPSG International, along with Eva Duarte, who works with the NCI's palliative care unit in Guatemala City. And we also have Dr. Bishnu Paudel, who works at a government hospital in Kathmandu. And we want to thank you all for being here today. Karen, if you can briefly, so the Pain and Policy Studies Group is having a conference right now here at the UW. Can you explain exactly what's going on?
Yes. We are a World Health Organization collaborating center with the Cancer Center, and we sponsor a fellowship program where we try to help countries identify barriers in their national drug control policies as well as their drug distribution systems that would prevent patients with severe pain from receiving much needed pain medications.
Which may seem like a really hard concept for many of us with easy access to pain management here in the U.S. But I know in Guatemala, it seems, I actually received, it's not readily available. Morphine is not available.
We don't have oral morphine available, and most of our patients have to pay for the treatment. So the government has to be aware of this and make a change in the policies and in the distribution of the medicines.
Is that the same where you're at?
Yeah, more or less. The most wonderful drug, morphine, for the cancer pain is not easily available and not easily accessible to the cancer patients who are in the pain.
So what sort of barriers does this create for patients needing treatments where pain is often an issue? Cancer just being one of many conditions.
Yes. If you take in account that 70% of the patients come from the rural areas, and there's only one cancer hospital reference for adults in the city, that makes opioid availability very hard for some patients. And most of them are very poor, so it's
just not available. How is the Pain and Policy Studies Group working to change that?
Well, when they're here, we really look at a lot of different things that can go on at one time. There can be barriers in their regulatory policy that can limit the physician ability to prescribe. There can be barriers in the drug distribution system where drug may be available only in the capital city and it's not getting to the rural areas. There can be cost barriers, supply barriers such as unreliable suppliers from different countries. So what we really do is we sit down with them all in one room for a week, and we go over the basic systems that have to be in place to make the medication available. And then at the end of the week, we sit and we talk about the situation in their country where we've identified blockages, and they draft a plan of action, and we provide technical assistance for the remainder of their 2-year fellowship. And so they will come back in a year, and we will have lots of email communications.
We're unfortunately out of time, but an issue that we'll definitely keep a close eye on. We appreciate you all being here today, and thanks for coming to Madison.